Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Friday, October 15th. We are joined today by the Yukon's Premier, the Honourable Sandy Silver, and the Yukon's Acting Chief Medical Officer of Health, Dr. Catherine Elliott. Our sign language interpretation is provided by Mary Thiessen and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name and you will each have 2 questions. Premier Silver?
Thank you very much, Pat. And good morning, everyone, and thank you for joining us virtually here on the traditional territory of the Kwalin First Nation and the Ton Kwatchen Council. It's great to be here with Dr. Elliott to provide you with a COVID-19 update. Since our last update, a little over a month ago, COVID-19 situation has changed and continues to change all around us. Alberta has been pushed to the brink, trying to provide general health care while grappling with alarming case numbers. The Northwest Territories and the state of Alaska have each dealt with widespread resurgence of COVID-19 as well. Delta has become the dominant variant, spreading throughout Canada. Schools throughout the country have been impacted by cases, including here in the Territory. And our case count has been increasing in recent weeks. We have seen time and again that the pandemic is a dynamic and rapidly changing situation that we need to actively manage in order to protect the health and safety of all Yukoners. Thanks to our early access to vaccines and the willingness of so many Yukoners to step up and to take their shot, our territory was able to emerge from the state of emergency this past summer. This allowed us to return to more normal routines as we all learn to live with COVID-19 as a preventable, endemic disease. Our government has moved towards a more targeted approach to respond to the threat of COVID-19 in the territory. We are, however, still in a public health emergency. COVID-19 remains a highly contagious disease and in some cases, deadly. We have now lost 10 Yukoners to COVID-19, with the latest death reported earlier this month. Each of these deaths are tragic, and I send my absolute condolences to friends, to families, and to loved ones of those who have passed on. Despite our high vaccination rate, we have seen COVID-19 spread quickly and ruthlessly through our unvaccinated population. The spread of variants, especially the Delta variant, has also increased and continues to put both unvaccinated and vaccinated individuals at risk in our territory. Our focus as a government remains protecting the health and safety of Yukoners. The Forging Ahead document that we released in August outlines our ongoing targeted response to COVID-19 in the territory. That response includes reducing the number of people in the territory who are susceptible to COVID-19 and its variants through vaccination, continuing to test and to find the virus in our communities, maintaining capacity in our health and social services system to respond to outbreaks when they do occur, providing supports to people who are the most vulnerable to severe diseases, and using targeted measures that focus on the areas of highest risk. Now again, you can find the Forging Ahead document online at yukon.ca. One of the key objectives of Forging Ahead is protecting vulnerable populations. We know that COVID-19 has different impacts on different groups in our territory, while certain factors like age, underlying health conditions, lower socioeconomic status make people vulnerable to severe disease, including the impacts of COVID-19. Delta is now the dominant variant of COVID-19 in Canada, and it is more dangerous than other earlier variants. Based on current evidence from public health officials, containing the spread of the Delta variant requires a vaccination uptick of at least 90% of eligible populations, We are not at that level of immunization. No Canadian jurisdiction is at that level of immunization. Nevertheless, we need to get there. More than 80% of eligible adults and children in our territory are fully vaccinated. We absolutely need to get that number above 90% to protect the health and safety of Yukoners and to keep us on the path of recovery. We are leading the country in the fight against COVID-19, but we need to keep going. Despite many changes that we've seen throughout the pandemic, we know for certain that vaccinations remain the best protection against all forms of COVID-19. And it's not just about protecting yourself, it's about protecting everyone in your community, your friends, your neighbors, your colleagues. It's about protecting all Yukoners, all Canadians, including our children and our youth that are not eligible to be vaccinated. Dr. Elliott, as the Acting Chief Medical Officer of Health, has provided new recommendations to address the current situation that will increase vaccination rates while ensuring that we continue to protect all Yukoners, including the most vulnerable in our territory. Our government is now planning the logistics around how we implement these recommendations, which will introduce major changes to ensure that our territory remains healthy, safe, and protected against the current risks that are associated with COVID-19. Today, I'm announcing that the Government of Yukon will soon require all government employees and all frontline health care workers in the territory to be fully vaccinated. Mandatory vaccinations will apply to all public servants, including teachers, as well as those who work in hospitals, long-term care homes, medical clinics, and allied health care settings. It will also apply to employees of our partners that the government funds to provide services to vulnerable populations and those in congregated living situations such as group homes, shelters, and the Whitehorse Correctional Centre. We absolutely need to do everything we can to spread COVID-19, and as the territory's largest employer, the Yukon government has a duty to lead by example and to do our part to keep Yukoners safe. This mandatory vaccine requirement will allow us to ensure a safe working environment for our employees, including our healthcare workers, while protecting the health and safety of the members of the public that we serve each and every day, especially our most vulnerable populations. This requirement will come into effect on November the 30th. This will ensure employees and frontline health care workers that have not yet been immunized will have enough time to receive both doses of the vaccination before the requirement comes into force. Proof of vaccination will also be required to access non-essential services and attend events in Yukon. This includes bars and restaurants, live music events, theater performances, cultural events, gyms, exercise, dance, and sport facilities. Proof of vaccination will also be required in order to participate in recreational activities for those who are over 12 years of age, including all organized sports leagues. This requirement will also come into place November the 30th. This will again allow time for government officials to work with businesses, stakeholders, and those impacted by this requirement to address the concerns and to answer questions. Officials will be reaching out to stakeholders and groups next week. Proof of vaccination will not be required to access essential services like grocery stores, pharmacies, libraries, or banks. These mandatory vaccinations and proof of vaccinations requirements are based on the recommendations of the Acting Chief Medical Officer of Health to limit the spread of COVID-19. These measures align with steps being taken in other jurisdictions across the country to increase vaccination rates and combat the Delta variant wave that continues to spread throughout Canada. We absolutely recognize that these measures may pose hardships for some. and bring relief to others. My sincere hope is that this will prompt vaccine-hesitant Yukoners to roll up their sleeves. Getting vaccinated remains the best way to protect the health and safety of everyone. We are very fortunate here in the Yukon. We have enough vaccines for everyone who wants one. We continue to encourage all eligible Yukoners to get vaccinated. Starting on Monday, the vaccine clinic here in Whitehorse will be open 5 days a week. Vaccines are also available in all Yukon communities at your local health centers. You can find information about the vaccines and how to get your shot by going online at yukon.ca/thisisOurShot. If you have not already been immunized, please, I implore you, get your shot. The vaccines are safe, effective, they save lives. It's as simple as that. I want to once again thank the leaders from across the territory who have stepped up and have taken their shot and who have talked publicly for their reasons for doing so. We need all leaders in our communities to work together to get vaccination rates up. We are all in this together, and we each have a role to play in keeping our territory safe and healthy. I'll now pass things over to Dr. Elliott to provide more information about the current COVID-19 situation and the plans that we have announced today, as well as several recommendations that she will be making to minimize risk between now and November 30th, when these new recommendations will come into effect. Thank you very much, everyone.
Thank you, Premier Silver. Dr. Elliott?
Thank you, Premier Silver. Good morning. Bonjour à tous. I'm grateful today to be speaking from the traditional territory of the Kwalindun First Nation and the Ta'an Gwich'in Council, and to share this beautiful Yukon October day with all of you. Today's update is a very pivotal one in our continuing battle against COVID-19. I'll start with an update on COVID-19 activity in the territory. As of 10 this morning, we have 63 active cases of COVID-19 in Yukon. The 7-day average of new cases, the daily new case count average, is 7. The 7-day average of active cases, or the daily active case count average, is 57. Percent positivity is 9%. I was saddened to hear this morning of 2 individuals who have been hospitalized overnight due to COVID-19, and both were unvaccinated. We have not had any medical evacuations due to COVID-19 for the month of October. We are monitoring and responding to a number of situations. I'll start with the older ones and move to the newer ones. Grade 4 Johnson Elementary School and Watson Lake School is nearing the end of the observation period from their outbreak, and we're expecting to declare this over early next week, given no new cases for several weeks. Grades K4 and 1, 2, 3 at Carcross Community School remain under observation. This morning, we declared an outbreak in the grade 4 class at Elijah Smith Elementary School. Those involved are being contacted and given further instruction. And there's an outbreak on the Victoria Gold Mine. We continue to see a slow, steady increase in case counts and now in hospitalizations. And we are seeing a consistent pattern of transmission between people within Yukon who are not yet fully vaccinated. We are seeing people crossing domestic and international borders infected and infecting others and leading to spread. This importation is a contributor, but a smaller contributor than the spread that we're seeing within Yukon amongst people who are not fully vaccinated. Based on our epidemiology, we're in a situation of steady increase, outbreaks, and increase in the complexity of cases and situations. Since these indicators are worsening, we need to act now to prevent what is possible in the future. Each of us, alone and collectively, must now more than ever take responsible action because of this pandemic. We are in the 4th wave with much of Canada, and we only need to look south to northern BC to see what can occur when case counts rise rapidly and the healthcare system is strained. We only need to look east to Northwest Territories to see how one event with a great deal of spread can seed into unvaccinated populations around the territory with devastating effects. I should note that both of these situations were among populations with lower vaccination rates than ours. We only need to look to Vic Gold to see how vaccinated people can and do become infected. And we know from our own epidemiology that across Canada and around the world that those who are vaccinated, who are infected, are far less likely to become hospitalized or die compared to the rate of those who are not fully vaccinated. Our own data shows infection rates in the unvaccinated are 10 times those in the vaccinated. And across the country, hospitalizations in the unvaccinated populations are 25 to 30 times more than those of the vaccinated. The Delta variant is now the dominant variant in Yukon. It is much more transmissible and requires a higher vaccination rate, and as well as our own actions to prevent spread. Already we've benefited from all of those Yukoners who have become vaccinated. In June, we saw that vaccination limited the spread of the Delta wave that we had here. Of the Gamma wave that we had here. And it has prevented numerous hospitalizations and deaths during that period. So we have some things that are on our side, a high vaccination rate so far, and good response to our situation, and some things that are concerning, a slow, steady rise, and a need to increase our vaccination rates. There's still a way to go. Let me talk a little bit about our vaccination coverage. There are high vaccination rates in much of the territory, and particularly in some communities. However, most communities have not reached the goal of 90% of those eligible. Among those over the age of 18, 85% have received 2 doses. The number of communities have high vaccination rates, and communities in the north and west of Yukon are leading the way. The vaccination rate in Whitehorse is 86%. There are certain areas and subgroups with vaccination rates below the 90% target, and let this be your challenge. Whitehorse, I'm seeing things climb up. We're now at 86%. See if we can reach 90%. Those 12 to 17 have also increased their vaccination rate since our last update, and now at 76%. Have a little way to go. Working age adults are also below the average. And an age-old rivalry between men and women. At this point, women are in the lead, 86%. Men, 82%. It's fun to make a little bit of lightness of this, but it is serious, and that is why we're taking serious measures. We've enabled and encouraged people to get vaccinated, and I've had to carefully consider and review the epidemiology here in Yukon and the effectiveness of these policies across Canada. And this is why I've recommended the mandatory vaccination of workers, particularly those who work with vulnerable populations, as a priority. And I support the leadership of the government is taking in other areas, such as an employee and a leader for Yukon, and offering mandatory and rolling out mandatory vaccination of workers on my recommendation. The second recommendation is a vaccine certification requirement for access to non-essential services. Mandatory vaccination policies for staff just make good sense right now. They help increase vaccination rates, and this is what is needed to help us stay healthy, avoid healthcare system strain, and even overwhelm. Those in long-term care facilities, for example, may not have chosen to be in care, and they have little choice over who provides their care. Those people who work with them should be vaccinated in order to ensure that infections and breakthrough illness in those settings do not result in higher morbidity and mortality amongst the elderly and those at risk. And then there are children who cannot yet be vaccinated. As parents, we should do everything within our power to protect our children including vaccination of ourselves. I know that vaccination is a choice, but for the first time, there will be consequences for choosing not to be vaccinated. As people seek these non-essential services, they will find that they are not able to do so unless they are vaccinated. Here's what we've seen across the country and here in Yukon. A person who's unvaccinated gets COVID and infects others who are not eligible for the vaccine. That same person travels and stays with people who are infected, potentially bringing COVID home. The vaccine is essential to prevent severe illness and death. Everyone has this power to make this choice and keep themselves safe. We're very fortunate in Yukon to have received our vaccine early and enough to vaccinate everyone who wants to get vaccinated. We've led the country with our vaccine response and uptake, but we need to keep this impetus going so that we can raise this percentage even higher. Putting these requirements in place will take time. And so I'm again making a couple of very strong recommendations to take us through this interim period. I've already asked people to wear masks in indoor public spaces, and I'm pleased to see so many people taking that advice. Experience across Canada and around the world has shown that early intervention and widespread adherence to mask wearing can reduce the overall numbers and rate of COVID-19 cases and ICU admissions, especially when combined with other measures like hand washing, physical distance. These measures are in place until these measures are in place, the vaccination mandates and the vaccine certification for access to non-essential services. I am strongly recommending that individuals who have traveled outside of Yukon avoid non-essential services for the 10 days until they are sure they have not returned to the territory with COVID-19. I'm also recommending that all out-of-territory school trips be cancelled until the end of January 2022, and that is to prevent our young people from traveling to locations where the fourth wave is crashing against the shores. I'm strongly recommended that group size be limited. For social gatherings where vaccine status is not known, 6 to 6. For larger vaccinated groups, no more than 20 people, all vaccinated. This is for indoor gatherings. For indoor organized gatherings, again, the strong recommendation is that these be limited to 50% of venue capacity unless everyone attending the event is fully vaccinated. And again, we're asking all businesses, services, and events to have on-site operational plans that include the details on physical distancing, staying home when sick, cleaning and disinfecting of shared services and hand washing stations. A little bit more on vaccines. Vaccine clinics are happening in Whitehorse and all communities, and the time to get vaccinated is now. Call your health center if you live outside Whitehorse. If you're in Whitehorse, drop in or call the vaccine clinics and get vaccinated. Now, I know not everybody is going to be happy about these recommendations, and I know some people will be sad about the losses of the things that we just took for granted before the pandemic, and others might even be angry. It's normal to have these feelings. What is not acceptable is to take out your feelings on the people around you, perhaps the people who are enforcing the rules that the government has put in place or recommendations that I've made, the people in your family, perhaps who are doing something differently than what you would like or expect. These are the time to be patient, to be kind to those around us, and direct your anger and frustration elsewhere. Some people are asking about third doses and boosters. We've provided third doses of vaccines to those who are severely immunocompromised and boosters to those in long-term care who need them. We are just awaiting now the NACI recommendations on booster doses for those most at risk and for those for childhood vaccines. We're also closely watching our own epidemiology on infections and severe outcomes amongst those people who are vaccinated. Here's some important ways we can stay healthy and safe. First of all, if you're vaccinated, thank you. And we can thank those people. They're part of the solution. We need people still to practice the safe 6 and wear their mask. And we need these because we're seeing spread. There's extensive testing available, and we're seeing that vaccinated people who become infected generally have mild disease and recover, but they can transmit to others and those who have not yet been vaccinated. So we're asking you to get tested if you have any symptoms and to wear a mask. When you're out and about, follow the guidance in healthcare settings and other settings. Please check in with First Nations governments and communities about any recommendations prior to visiting communities. We'll get through this together. And I suggest that instead of focusing on the things that we've lost or the things that we don't like about the current situation, that we focus on the things that we are grateful for and the things that bring us joy. The beauty of the northern sunny fall day, the long dawn and dusk that makes our colors dance as the winter approaches, the northern lights. The bountiful harvest from Yukon's wilderness and from our own gardens. For those we love near and far and the support that they offer us. For the ways that the pandemic has brought people back really to the essence and the core of what is essential and most treasured in our lives. That we have had access to services, including our basic needs, education, healthcare, water, etc., and have had few of the interruptions that have occurred around the world and throughout Canada. And that we live in a society that is free and inclusive and where our resilience is one of the ways we take care of each other. Give yourself a healthy break from the news and instead use your electronics to stay connected with others and to support others. Listen and share as we travel through this pandemic together. There have been challenges and times of uncertainty. There have been losses throughout it all, and we've found ways to stay connected and support each other. We are an inclusive people in Yukon. Let's stay kind and respectful as we walk this path together. Thank you. Shonitan, Masicho, Gunoshish, merci. I'm happy to take any questions.
Thank you both. We'll now go to phone lines, and we'll begin with Luke from CKRW.
Hi. My first question is for Dr. Elliott. We're seeing a few cases pop up in schools, and like you said, there was an outbreak declared. Are there recommendations or possible increased restrictions or guidelines coming in schools now to further limit the spread?
Thank you for the question. We have worked very closely with our education partners to make schools safe this year, and we continue to do so. We have robust, strong operational plans that are being played out in the schools every day on the school buses and in school activities, and these continue to happen. I've made a couple of recommendations today that school trips out of territory be canceled until January of 2022. And we also react in a targeted manner when we see cases in schools, and if we see any evidence of a couple of cases in a class, we take stronger measures. So we're continuing to do what we need to do in schools to keep them safe, and these are the ways that we are working together with education and with the government, with parents and students and YCDC and all of our partners in order to keep schools safe. Thank you.
Do you have another question, Luke?
Yes, this is probably a question for both of you. We've got some of the communities in the Yukon with lower vaccination rates, and obviously there's about 6 weeks before this mandate kicks in for non-essential services. What is the government's approach going to be to try and push people through their vaccine hesitancy to get as many people as possible vaccinated before this mandate kicks in?
Sure. I think people only need to look around to the east of us and to the south of us to see what's possible when the vaccine rates are lower, as well as think about what we're seeing here in the epidemiology with the gradual increase of case counts. We're doing well so far, but we have a ways to go. There are The Premier has mentioned that the clinic here in Whitehorse will be open 5 days a week. We have clinics, the government has clinics in communities, and we continue to work closely with our partners in discussions in vaccines. Every day we answer questions of people about their concerns or interests in vaccines, coming programs, etc. So keeping the information flowing, keeping ourselves available, these are some of the ways that we can increase the work with vaccine hesitancy. I also think it takes every single person to work on vaccine hesitancy. It takes people listening and caring, taking the time, explaining their reasons for getting vaccinated, and also listening to the concerns. Premier Silver?
Yeah, I would agree with all of that, and I'd just add that, throughout the last almost 2 years now of, everybody grappling with COVID and educating themselves and staying up to date with recommendations and changing understanding from the scientific community, as a government, our approach has always been to give as much information as we possibly can, direct people to those areas, either the CDC or NACI or the Chief Medical Officers of Health or other authorities, where you get the information about the questions that people have and trying to veer people away from misleading information, getting recommendations out as quickly as possible to then be able to work on the recommendations and then the logistical challenges. And we've seen changing philosophies along the way as well. Path forward, going into forging ahead, approaches change. Our abilities also change. We've seen a Yukon community who has, for the most part, stepped up and got vaccinated, still having questions, getting the right answers. We're at a place now where, again, we're seeing a change. We're seeing a change across the nation, across the world. You want to go to a Leafs game, you want to go to a Habs game, you need to show your vaccination. You want to, we want to get back to normal. How do we do so? And so these are not easy decisions to be made. But at the same time, I think the message that I'm hearing right across the nation when I talk to other leaders, when I talk to my colleagues, when I talk to the professionals in justice, in health, we all have choices. But those choices come with ramifications. Right? You have a choice to be vaccinated or not vaccinated. But those choices come with ramifications. And that's where we are as a society right now. That's where we are as a nation. And the recommendations here are thorough. They're very well thought out. They're very well researched. Lots of conversations have been had, and we need to work on them. We need to implement them. So again, what we can do is follow science, and that's what we've always done. What we can do is get the recommendations out as quickly as possible and implement. And so far, the approach of following science, following the Chief Medical Officer of Health, it's worked for Yukoners for the most part. But like I said in my notes, Luke, 10 people have died already. And the Delta variant is different. It's aggressive. It's a game changer. I've had 2 Chief Medical Officers of Health now saying, if you're unvaccinated, it's just a matter of time. It's just a matter of time. And as we start to see increases to people being hospitalized, good people being hospitalized, these are the things that are necessary to keep everybody safe.
Thank you. We'll move now to Haley, Yukon News.
Hi, thank you. My first question, I assume the enforcement measure being used for these new recommendations is the Public Health and Safety Act. Could we get a little detail on what sections enable the enforcement of these things, since it's no longer a state of emergency?
You're right that it's not under SEMA and that our legislation be out on public health. Again, that's a big question. It depends on what parts. So more details will be coming out as far as NGOs, contractors, government employees, non-essential. So all these details are going to come out, but we're moving forward. All these logistics, it's a lot of information. Today's announcement is about giving a heads up of where we're going as a territory. These recommendations will come into effect November the 30th. We're now telling people that we're going to be preparing and planning, and more information will come out in the next few weeks. I think the key message right now is the clinics are open and the deadlines are coming. That's the most important message. Today, we will be coming out with a lot more information about the specifics, about the legislation, specifics about how we're going to work with private sector, public sector, NGOs, so more details to come. But right now, it's about announcing, forecasting, and preparing.
Thank you. Haley, do you have a second question?
Yeah, I do. Thanks. Respect that, more details are coming out. I'm curious for, let's say, bars and restaurants as an example, whose staff will be preparing to be telling people that they can't come in if they're not double vaccinated. Will there be supports around those folks who have to enforce that? Is the RCMP the enforcement measure, or will there be other supports for people who sort of aren't trained for confrontation but are going to have to be explaining these new policies to people?
Yeah, so again, with SEMA not being, we're not under a civil emergency measure right now, so we do have authority through the Public Health Act, and RCMP also have authority as well, both extremely important in this case. One place to look, Haley, as well is, the recommendations here are very similar to what's playing out in British Columbia. So what we're doing is we're working with our colleagues there as well for things like development of apps for restaurants and bars, taking their technology and applying it for Yukon. And I guess the good news of us coming a few weeks out of the gates after BC is all the trials, tribulations, lessons learned. We have a jurisdiction in Canada that we can work with and apply solutions from.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, good afternoon. Can you hear me?
Yes.
Go ahead, please, Tim.
Okay. First question is probably more for Dr. Elliott. I've been told this week that COVID vaccine shots haven't been available at the convention center here in the city in favor of the flu shots. In retrospect, with all of this going on, does that look like it was a good idea?
I'm not sure this question's for me or even if it's a helpful question. Influenza vaccine is really important. Influenza is a disease that kills people in the territory every year and can cause severe outcomes amongst the elderly and as well as the very young. Influenza vaccine campaign has started. I strongly encourage those who are eligible to get the vaccine as soon as your eligibility comes up. We always start with the most vulnerable. This year, we are seeing spread of respiratory viruses, including COVID-19 and influenza, and you can receive both of those vaccines together. And I strongly recommend that people do get both of those shots. There have been situations where people are dually infected with influenza and COVID-19, and I can tell you that their outcomes are worse than they would be had they been singly infected. So I think it's extremely important that we get both vaccines. The COVID-19 vaccine, there will be some serious implications for those people who don't get vaccinated, but not for the influenza vaccine. Thank you. Yeah, do you want to speak to that? Yeah.
No, not much to add to that.
Do you have a follow-up, Tim?
Yes, I do. And this one, again, would probably be for Dr. Elliott. Last week in the Northwest Territories, public health officials were attributing some of their outbreak to the waning effects of the COVID vaccine. Any thoughts on that? Is that something that's happening here?
The question is about the waning effects of the COVID vaccine. So anybody who's had a tetanus shot, maybe people remember getting it as a young child, and then usually it's due in young adulthood or adolescence, and then every 10 years or so after that. We do this with vaccines because vaccines cause our immune systems to remember what they've seen before and to react more quickly when they see it the next time. However, slowly over time, our immune systems start to forget. And there has been evidence of waning immunity or decreasing response to the COVID-19 virus after vaccination. It occurs quite a long ways out, and the evidence is really being built right now. And this is why our National Advisory Committee on Immunization is examining the data on booster shots for COVID-19 next week, and we expect some guidance on that, and why the FDA is also looking at that. Have we seen evidence of waning immunity here in Yukon? We have seen an increasing number of cases amongst a percentage of cases amongst those people who are vaccinated. What's been shown with waning immunity internationally and in the studies that have been released to date is that while the immunity wanes for infection, getting infected, if it wanes, which is not clear yet, for severe outcomes, it wanes much more slowly. If we require a booster shot in order to keep our immunity levels up, which we may well, and that may be the case, we're waiting for the guidance of our National Advisory Committee on Immunization, and I will make recommendations for Yukon accordingly. Thank you.
Thank you. We'll move to Chris, CBC.
Hi, good morning. Thank you. I guess this is a question for the Premier. As you mentioned in response to Haley's question, this is under the Public Health Act and not under CIMA. Can you explain why that is and why not give the Acting Chief Medical Officer of Health order-making powers as opposed to recommendations?
To be clear, the Chief Medical Officer of Health under the Public Health Act does have that authority. A Civil Emergency Measure Act was lifted because we don't have the justification for that act anymore. However, when it comes to the health and safety of Yukoners, we do have a Public Health Act. And that's not that in that act there is authority.
Thank you. Follow-up, Chris?
Yeah, I guess the other follow-up that I have is when the government lifted CIMA and eased restrictions in the summer, I asked you, Premier, and Dr. Hanley, how much responsibility do you think you take for the people who will get ill as a result of that decision? Now, Dr. Hanley has gone on to get a new job. But since you're still here, how much responsibility do you think you bear for the positive cases that have come since the government lifted restrictions this summer?
As the Premier, I take ultimate responsibility, absolutely. But at the same time, our approach, I believe, is the best approach, which is to follow implicitly the Chief Medical Office of Health. And to follow the recommendations. There's a lot of different ways that other jurisdictions have decided, nationally, internationally, to move forward, and we see the perils of other methods. As the Premier, this is my ultimate responsibility. Absolutely. Do I question if mistakes have been made? I mean, isn't that what science is all about? But at the same time, the least amount of mistakes will be made if politicians follow science.
Thank you. On va maintenant passer à Vincent, Radio-Canada.
Oui, bonjour. Une question en français, Dr. Elliott. Est-ce que vous pouvez juste réexpliquer pourquoi maintenant, pourquoi changer, mettre en place ces mesures maintenant?
So, Dr. Elliott, can you please explain in French why it's the right moment to change the advisory that you had right now?
Merci pour la question. On pensait au sujet des mesures ici au Yukon. On a le document aller à l'avant qui distribue les outils qu'on a. Et aussi, on suivi notre propre épidémiologie et les sciences qui émergent partout dans le monde, ici au Canada aussi et bien au Yukon. Maintenant, on on voit les cas, le taux des cas, ça commence à être de plus en plus chaque semaine. Et aussi, on voit que on a des éclosions dans les écoles, à une mine ici au Yukon. On a vu aussi au sud de nous, au Colombie-Britannique, au nord de Colombie-Britannique, à l'est de nous, au territoire du nord-ouest, ce qui se passe, ce qui peut se passer quand il y a une petite communauté qui n'est pas vaccinée, que le taux, pas seulement des cas, mais des gens à l'hôpital, des décès augmentent à cause de transmission de l'un à l'autre. Ici au Yukon, on a un bon taux de vaccination à 85% de ceux qui sont éligibles pour la vaccination. Mais quand même, on a le goal de 90 ou bien 90%. On a fait tout effort d'avoir des cliniques de vaccination et des opportunités de vaccination partout dans le territoire. Et les infirmières ont travaillé fort pour offrir bien l'information et les vaccinations. Quand même, on n'est pas encore à cette destination de 90%. C'est pour ça, l'épidémiologie ici, ce qu'on voit partout dans cette quatrième vague, c'est pour voir ce qui s'est passé avec les programmes des vaccinations obligatoires et des certifications pour vaccination. C'est à ces raisons que j'ai recommandé ces deux programmes, la vaccination obligatoire pour les travailleurs et les certifications de vaccination pour entrer aux services qui ne sont pas essentiels. On a aussi maintenant le variant Delta. C'est un nouveau jeu avec cette variante. C'est plus transmissible que l'autre variant. Et aussi, on voit cette transmission même entre les gens qui ne sont pas vaccinés. Et ça, c'est le plus grand problème maintenant. Mais parce qu'il y en a cette population, on voit aussi les transmissions aux personnes qui sont vaccinées. Et c'est pour ces raisons que c'est maintenant le bon moment de recommander ces programmes. Et c'est le meilleur balance maintenant entre le droit des individuels et le droit de société et communauté de ne pas avoir les taux à l'hôpital, aux santé publiques et les décès qu'on peut avoir. Merci.
Merci. Avez-vous une autre question, Vincent?
Oui, merci. Une question pour vous encore, Dr. Elliott, et peut-être pour M. le Premier ministre. Est-ce que vous connaissez le pourcentage de personnes non vaccinées parmi les employés du gouvernement et est-ce que vous êtes inquiet du fait que si certaines personnes refusent de se faire vacciner, je pense par exemple dans le secteur de l'éducation et de la santé, ce sont des secteurs où on manque déjà de personnel. Est-ce que vous êtes inquiet à ce sujet-là?
So, do you have the percentage of people working for the government of Yukon that is not vaccinated at this point? And what kind of impact is it going to have on education and the rest of the public service to make sure that these people are going to be vaccinated?
We do have some numbers as far as the breakdown. I haven't seen a complete breakdown based upon different sectors of our government. But I guess really the question is about concern about staff shortages, and my answer would be I absolutely am concerned about staff shortages. There will be extreme challenges ahead, absolutely. The Public Service Commission is working through the details, the logistics of this requirement, the statistics for our employees, and we'll be working very, very closely with our partners that provide services to vulnerable populations as well to find out what the concerns are going to be there. What I'm hearing nationally, locally, I'm hearing a lot of support for these measures. It really comes down to the management of risk. On a short term, there will be a huge challenge here as far as the risk or as far as the challenges of having shortages of staff. I'm hearing from folks anecdotally working harder in the short time in a setting where people are vaccinated. Would most likely be less hard work in a longer term setting if we continue to see outbreaks and we continue to see wave after wave. These steps that are being taken based upon the recommendations of the Acting Chief Medical Officer of Health, they are to limit the spread of COVID-19, ultimately. And so our government's remaining very focused on that, and we will weather storms and hardships for that ultimate goal.
Thank you, Premier Silver. Et maintenant, Marine, l'aurore boréale. Marine, es-tu là?
Est-ce que vous m'entendez?
Oui.
Oui, pardon. Le 5 jours, c'était la journée pour la santé mentale. Est-ce que, suite à cette annonce, les augmenter les ressources en santé mentale, notamment pour se sentir exclus ou stigmatisés par rapport à cette annonce, s'ils faisaient le choix de ne pas aller dans la direction des recommandations? Y a-t-il plus de services à trop faire en santé mentale?
So the question is about mental health. And I'm sorry it broke quite a bit, but what will be the implication for mental health in terms of the services that will be offered, in terms of what might happen with mandatory vaccination, and what effect it will have in general on the services being provided?
It's absolute. COVID from the beginning days is the great equalizer as far as mental health issues. We've all suffered throughout the pandemic because of mental health, because of isolation, concern, stress, fear. It'll be no different under these new recommendations. And every government, including ours, has an obligation to make sure that we provide the proper programs and services as people go through these challenging times. So it will be immense. And so we need to make sure that we have the programs. Yukon was the lead nationally on promising practices, highlighting all of our different approaches in all of our regions, the territories, and the provinces when it comes to mental wellness and substance abuse. We need to summate the results of that podcast series to the federal government to explain what we're all trying and the trials and tribulations there. But yeah, absolutely. This is another one of those scenarios where the evidence is there that we need to do more when it comes to grappling not only with our public servants, but the general population when it comes to the effects of this devastating disease.
Dr. Elliott?
Yeah, thank you. Would you like me to translate a little bit what you said? Yeah, okay. Premièrement, le premier Silver, il a dit que c'est vraiment une situation qui peut avoir des impacts sur la santé mentale des gens au Yukon, même à cause des ressources humaines et les impacts là. et aussi que Yukon est un des premières, il avait de reconnaissance au sujet des programmes santé mentale aussi. Et moi, je veux ajouter un peu que c'est vraiment un balance. C'est un balance très sérieux. À l'un côté, on a des conséquences pour les gens qui ne sont pas complètement vaccinés. À l'autre côté, on a des risques et des vrais problèmes qui sont vraiment sérieux. COVID trouve les gens, les gens et les populations où les gens ne sont pas vaccinés. Et on a vu partout au Canada que ces gens deviennent malades, ont besoin de l'hôpital et même ils sont des décès. Et ça inclut les parents des jeunes enfants qui ont maintenant pas leurs parents. Ça inclut les femmes enceintes qui sont pas vaccinées, qui ont besoin de l'hôpital 3 fois le taux des femmes qui sont vaccinées, qui sont enceintes. C'est un vrai problème, c'est sérieux. Et aussi, le taux aux hôpitaux, ça a des impacts sur les gens qui sont même vaccinés ou pas vaccinés, mais qui sont dans les accidents des véhicules, les gens qui ont besoin des services à cause d'urgence, et même les gens qui sont attendus longtemps pour leur procédure ou bien des autres choses. Et ça, c'est le balance on doit considérer dans ces décisions. C'est vraiment sérieux et c'est la meilleure chose qu'on peut faire maintenant, c'est ces programmes obligatoires. C'est pas quelque chose qu'on pense qu'on n'a pas pensé beaucoup, on a bien vu l'évidence, on a bien vu ce qui peut passer ici sans ces problèmes. Et on a une variante Delta et même une pandémie qui est vraiment sérieuse. Et c'est à cause de ça qu'on prend ces mesures.
Avez-vous une autre question, Marine?
Oui, merci. Merci pour avoir répondu. Ma deuxième question, c'est est-ce que, si on vise le pourcentage de 90% de la population éligible vaccinée, est-ce que les recommandations qui sont faites aujourd'hui sont prévues pour être changées une fois qu'on aura atteint le taux de 90%?
So, since we are aiming for 90% of the population being vaccinated, if we achieve this number, will the measures that are being announced today will be changed in the future once we reach that 90% target?
If there's been a medical community around this world who has found what the actual magic number is for herd immunity or for plankton the curve, I'd like to see it. I believe, and the doctor can correct me if I'm wrong, the ultimate goal is to reduce the strain on our system. So these are temporary measures, and when we see the evidence that they're not necessary anymore, as every single recommendation and requirement that we've gone through, we will reevaluate at that time. But these are temporary measures.
Thank you. I'd like to thank everyone for their time today. COVID-19 updates will take place as required. Please visit yukon.ca for daily case counts.